Good morning, everyone. My name is Simran Chaudhary, and I welcome you all on behalf of Voice of Healthcare to a podcast series Nurturing Bonds Experts Insights on Breastfeeding. This podcast series aims to educate and support breastfeeding mothers and their families. This year's theme is Closing the Gap, which is breastfeeding support for all, which resonates deeply with our mission to provide comprehensive support and awareness for breastfeeding mothers in all their diversity. To celebrate this week, today we have with us as our guest Dr. Nidhi Gupta. She is a neonatologist, senior consultant at Amrita Hospital Faridabad. She has been working at Amrita Hospital since its inception as a senior consultant in Department of Neonatology. She has trained in pediatrics as neonates in UK, including some of the best hospitals like Great Ormond Street Hospital for Children, Imperial College Healthcare Trust for more than 12 years of experience in UK. And in India, it's 6 years plus experience. Welcome to our show, Dr. Nidhi Gupta.
Thank you, Simran.
Thanks a lot for taking out time and coming to our podcast for sharing your insights and expertise with us on this special occasion.
It's an absolute pleasure because we are also celebrating the World Breastfeeding Week this week from the 1st to the 7th August 2024. And it's done to celebrate awareness around breastfeeding and to support and promote exclusive breastfeeding for the first 6 months of age.
Yes, and without any delay, I would like to know and start my conversation with you that from your extensive experience, what are the most significant benefits of breastfeeding for neonates, especially those at high risk?
Okay, so like you said, we work in a neonatal intensive care unit and we are dealing with preterm babies born like 600, 700 grams, or babies born on time but who have some difficulty at birth, be it heart problem, lung problem, etc. And breast milk, it's like the first vaccine for the baby. The initial milk that the mother has, also known as colostrum, we also call it liquid gold, simply because it is so rich in antibodies. All the infections mother has had till date, she has those antibodies in that milk, and those get transferred to the baby. We can give this via a feeding tube that we place in the stomach, and it helps protect babies against infections, especially because their immunity is so low. So they protect against pneumonia, diarrhea, ear, nose, throat infections, and all other infections, especially tummy infections, which they're very prone to. So, we just go by breast milk and it is readily available, and it helps in bonding as well, which is very important for these children. Like studies have shown over bonding that bonding is not just bonding between mother and baby, it also helps in stabilizing their heart rate, breathing, etc. So, yes, it's the best for the baby, especially high risk babies.
That's great because the only relation that baby knows in this earth when they are born is their mother, the heartbeat, the smell, I think, and that's how they connect their bond when they meet each other.
True, true, yes, yeah.
And how does breastfeeding contribute to neurodevelopment of high risk neonates? And what specific benefits have you observed in your practice that it has helped the breast milk has helped baby to grow or to overcome that high risk diseases they have born with?
Okay, so that's a very interesting question, and more so because I'm really interested in a long term follow up of these neonates. So, we aim for something called intact survival. It's not just they get well, go from NICU, but also they stay well and grow well and develop well physically and mentally. So there are many studies where they have taken small babies and followed them up till 7 years, 10 years, and so on and so forth. And the IQ of these breastfed babies they have found is better than compared to the formula fed babies. Not only that, their academic achievements, etc., is also been better. So I always say this to moms. I mean, it may be a bit of an overboard, but I always say this to mothers that अगर आप अपना दूध पिलाओगे तो आपका बेटा साइंटिस्ट बनेगा या बेटी साइंटिस्ट बनेगी. I know it's a bit of an overboard, but the idea is just to convey that you're securing long-term future, not just for health, but also academically for your child if you breastfeed your baby. So I think it's really important for brain development of these babies as well.
And I think that's how doctors can motivate mothers to do more of this. And you know
Yes,
that अच्छा ठीक है भाई कल को मेरा बेटा scientist बनेगा and it's actually scientifically proven, right?
proven. Yeah,
Yeah.
true.
And what common challenges do you think this new mother face when breastfeeding their high risk neonates, and how can they overcome these challenges? Are they different from the normal pregnancy or normal deliveries which mother experience, or they are something else?
Yeah, so breastfeeding, it doesn't come without challenges. I always tell parents it's like learning to ride a bicycle. You will fall few times, there'll be occasions when you go off balance, but then eventually you master it and your baby masters it as well. इतने छोटे बच्चों में जब हम ब्रेस्ट फीड कराते हैं तो यूजुअली वन ऑफ द चैलेंजेस इज पुअर सक उनका मुंह छोटा होता है उनकी मसल टोन इतनी स्ट्रांग नहीं होती सो व्हेन दे गो ऑन टू मदर्स ब्रेस्ट फॉर द फर्स्ट टाइम यू नो दे आर जस्ट लर्निंग टू सक और वो सक swallow breathing का coordination नहीं आता so what we do for that is we encourage our mothers for family centered care especially at Amrita the mothers are involved in cares early we teach them some oral stimulation like some cheek massages, some tapping of the lips, massage for the cheeks. We also encourage them to put the baby on the empty breast. So शुरू में we do something called non-nutritive suck, जिसमें basically nutrition नहीं है मतलब मदर ने अपना मिल्क एक्सप्रेस कर दिया और फिर बच्चे को ब्रेस्ट पे डाला ताकि बच्चा थोड़ा थोड़ा सक करना सीखे और जब वो सीख जाता है 1.5 किलो का हो जाता है 1.8 34-35 वीक्स का हो जाता है तो हम एक्चुअल ब्रेस्ट फीडिंग शुरू कराते हैं सो आई थिंक सक ओवरऑल लर्निंग हाउ टू फीड is very difficult in these babies so we aim to strengthen that by encouraging mothers kangaroo mother care कराकर और चीज़ों से भी we encourage that.
I think that is very difficult because what little bit I know about the normal pregnancy and normal when exact date when the babies are born, the difficulties and challenges are different. But with premature babies and neonates, I think this is a very difficult to have that coordination. As you said, their muscles are not toned and they do not know how to make do this happen. So yeah, it is very difficult, and you guys are doing great job on this.
Hey, Simran, and especially, we say the mothers and our sisters, the nursing staff, I think they are the core of NICU. So they are like part-time mothers and the mothers together. We all, as a teamwork, we encourage this to happen. So hats off to our nursing team as well there.
I
Mm.
think it's all team efforts. You, with all the nurses, are putting great effort for this, for the better care of mother and child. And thank you for that. So, moving on, how can neonatologists and pediatricians support and encourage breastfeeding among new mothers, particularly those with premature or high risk infants?
Okay, so हम क्या करते हैं? This is what WHO and UNICEF recommends that start early. कब? प्रेगनेंसी में ही तो प्रेगनेंसी में ही हम उनको सेंसिटाइज कर देते हैं थ्रू आवर ऑब्स्टेट्रिक टीम विच इज़ वेरी डेडिकेटेड थ्रू आवर लैक्टेशन काउंसलर्स सो नाउ डेज ईच गुड हॉस्पिटल हैज लैक्टेशन काउंसलर्स हु आर ट्रेन्ड एंड उनके थ्रू हम मदर्स को एंटीनेटली एजुकेट करते हैं कि कितना इंपॉर्टेंट है ब्रेस्ट फीड कराना नो मैटर आपका बच्चा किस डे पे हो जल्दी हो लेट हो टाइम पे हो and not only that उनके न्यूट्रिशन पे गुड स्लीप गुड हाइड्रेशन ड्यूरिंग ब्रेस्ट फीडिंग एंड जब एक बच्चा बॉर्न होता है सिमरन वी एम्फेसाइज ऑन स्किन टू स्किन तो चाहे सिजेरियन हो चाहे वजाइनल हो हम बच्चे को स्टेबलाइज करके मदर की स्किन पे ज़रूर डालते हैं चेस्ट पे ज़रूर डालते हैं और ये जो इनिशियल टच है ये एक फिर सब्सिक्वेंटली ब्रेस्ट पे भी डालते हैं दिस ब्रेस्ट फीडिंग विद इन 1 आवर ऑफ बर्थ इज वेरी इंपॉर्टेंट इन ऑल बर्थ्स ऐसे encourage करते हैं एंड वन अदर थिंग वी टेल पेरेंट्स इज कि खाली आपके बच्चे का बेनिफिट नहीं है ये मदर्स को भी ब्रेस्ट और ओवेरियन कैंसर के लिए लॉन्ग टर्म प्रोटेक्शन देता है एंड आई थिंक दैट इज़ वेरी इंपॉर्टेंट इफ यू कैन रिलेट टू मदर्स एज वेल कि ये आपके लिए भी उतना ही ज़रूरी है और पोस्टपार्टम स्ट्रेस का तो हमने सब सुना ही है प्रेगनेंसी के बाद आई रिमेम्बर माई टाइम हम लोग सब थोड़ा सा वो ब्लूज हो जाते हैं बट ब्रेस्ट मिल्क हेल्प्स द बॉन्डिंग ऑल्सो हेल्प्स टू रिड्यूस दैट स्ट्रेस ऐसा स्टडीज ने दिखाया है कि मदर के स्ट्रेस लेवल्स भी कम होते हैं
And I think that's good if, like you said, it always helps to mother and child. But after the delivery and the period that is over, it helps mother to delays chances of ovarian cancer and breast cancer. If that is this important, then that is why we're creating this kind of awareness to all our listeners and audience. Also, I have
Obviously.
one more doubt. Like during the COVID times, there were so many complications, and some afra tafri was going on. Nothing was clear and all. So, if mother is COVID positive and the child born, does then also you encourage breastfeeding at that point of time? If yes, does that the baby got COVID, or if yes or not, how is that baby now protected against that virus because he got that immunity at the birth?
So COVID, is still very gray area जो बहुत अच्छा रिसर्च नहीं हो पाया. But there were few studies. पहले ही कहा गया था कि मदर को सेपरेट आउट करो, आइसोलेट करो, But gradually it was seen that actually no, keep the baby with the mother, let the mother wear the mask, wash her hands. And this is what we tell for each fever for that matter. Ki wash your hands, just make sure mask पहना हो, हैंड वॉशिंग हो. फिर आप कोई भी फीवर है, जनरली ब्रेस्ट फीडिंग कभी भी कॉन्ट्रा इंडिकेटेड नहीं होती, एक दो कंडीशंस को छोड़ के. तो कोविड में भी हमने यही किया. मुझे अभी तक याद है, कोविड में बार बार क्वेश्चन उठता था कराना है नहीं कराना है, प्रोटेक्टिव है कि काउंटर प्रोडक्टिव है. बट एक्चुअली देखा गया कराने से वो बच्चे ठीक रहे. वेदर वायरस मिला नहीं मिला, वी ऑल डोंट नो एंड क्या इफेक्ट रहा. बट मैंने तो जितने भी बच्चे हमने फॉलो अप किए कोविड टाइम्स के, वी हैव सीन देम टू बी हेल्दी, ब्रेस्ट फीडिंग, थ्राइविंग वेल. सो आई थिंक ये कोविड में मिथ था नहीं फीड कराना. बट दिस इज व्हाट आई टेल टू माई पेरेंट्स इवन नाउ, दैट जब कोविड में फीडिंग अलाउड था तो अभी आप फीवर से डिमोटिवेट मत हो जाओ. जस्ट टेक
Hmm.
पेन के paracetamol with precautions and do regular breastfeeding.
And like you said in during the question answer round, that this you called is that golden liquid, golden
Hmm.
the first vaccine. So I think it
First,
can never harm a baby.
it cannot. Yes, वो हमेशा एक ड्रॉप बनी होती है, वो गोल्ड कलर की होती है. एंड वी से कोलेस्ट्रॉम इज लिक्विड गोल्ड, क्योंकि वो छोटा सा ही है बट इट इज सो बेनिफिशियल. इट्स लाइक प्राइसलेस.
Yeah, and only it is customized for that particular baby.
It is customized for that particular baby. Yes. And we say it is readily available, there's no cost attached. So, if you
Exactly.
consider कि Indian में रहता है, तो we say you drive, you go by plane, you go by breastfeeding, you don't need to warm the water, add milk, do all that tam jam. You can just breastfeed. Bindas.
And sustainable, environment sustainable as well.
Sustainable as well, yes. And the right temperature. I think that's very important. Mother की warmth से बिल्कुल सही temperature, ना गरम ना ठंडा, just the right temperature.
Very true. Finally, what message would you like to convey to all our listeners about the importance of breastfeeding, especially during this, especially for the for our new mothers, the expecting mothers who are at little uncertainty, should we do this or not and all, because there are so many myths attached to it, right? So, what message would you like to give?
So I think I'll just like to sum up by saying अपने बच्चे को अपना दूध ज़रूर पिलाएं. माँ का दूध स्पेशली फर्स्ट 6 मंथ्स एक्सक्लूसिव ब्रेस्ट फीडिंग, यानी सिर्फ और सिर्फ आपका दूध. नो वाटर, नो घुट्टी, नो पानी, नो शहद, नो गाय भैंस का दूध, नो अदर मिल्क. Just breastfeed, breastfeed, breastfeed. And I'm sure you and your baby will be well. Make sure you sleep when the baby sleeps. Eat healthy, plenty of sleep, no stressing, and you know you and your baby will be like pro in breastfeeding in a few days time. And don't be demotivated अगर शुरू में उलझने आए, challenges आए. That's common. That's like learning to ride a bicycle. Gradually you will just be through. And first 6 months you will always cherish this moment. And your baby, you are securing your long term health of your baby. It's like long term health and wealth for the baby. Thank you.
Thank you so much, Doctor, for sharing your expertise and insights with us. This means a lot to us, to all our audience, and the new expecting mothers as well, most importantly. And thanks a lot for giving your time to us.
So thank you, Simran. आपके through we can reach out and connect to the wider community and convey this message. So yes, I think we should all just encourage and promote breastfeeding, especially exclusive for the first 6 months. Thank you.
Yes, and we are doing this together.
Yes, definitely.
Yeah.
We are in this
Thank
together. In fact, this theme is closing the gap. support all. So, support for all. So, yes, we are together in this.
Correct. We are. It's all towards the theme that closing that gap which this
Yeah,
myth and misconceptions are around. Yes.
true. So true. Yes.
Yeah. Thank you.
Thank you, Simran. Thank you.